Welcome back to another edition of Political Breakfast here on WABE. In for Tharon Johnson this week is Saba, Executive Director of the Atlanta Civic Circle, and our Republican strategist, Brian Robinson. Also here, our producer, Lily Oppenheimer. So hello to all of you, and then happy Thursday.
Absolutely.
Hello.
Hey, guys.
Medicaid making news this week and last week and the week before as the cuts are advancing in Washington under this new administration, the Trump administration. And Georgians stand to feel the pain, don't they?
Well, all Americans do to some degree. Georgians perhaps less than many other Americans because we have kept a fairly skimpy Medicaid program as a cost containment mechanism. We have not brought as many people onto that system as other states have. So we are shielded to some degree. But nevertheless, we have a big nursing home population, many of whom, 70+% of whom, do get Medicaid benefits. This could be a threat to that infrastructure because if those funds close, those homes close, and access declines as Georgians begin to age into the nursing home population years. Like we have this population bubble coming through that is now getting to the age where they need nursing home care, and that number of people is huge. So demand is going to skyrocket, and we got to make sure that they have access, that there's infrastructure there to take care of these folks, and so they have the health care that they need in their last years. So let's think about the consequences of that as we make this public policy. Also hugely important to our hospital infrastructure. More than 50% of births in Georgia are paid for by Medicaid. It's a bit of a shocking statistic, but that's what it is. And so hospitals depend on that funding because they got to deliver those babies, whether or not the mother or the family can pay. So our healthcare infrastructure in the state is very much dependent on Medicaid. At the same time, Medicaid spending is not sustainable. We are across the board with entitlement spending way over indexed with what is affordable for our country. We got to make some tough decisions, but it can't be a lopping off of hundreds of billions of dollars because it would have immediate and catastrophic consequences. We got to be smart. We got to be long term in how we begin to rein in the cost.
What I have here is nearly 2 million low-income Georgians depend on Medicaid. Saba, that sounds like a pretty huge swath to me.
If the Republican budget moves forward with a third of Medicaid funding cut across the country, here's what that means for Georgia. 120,000 rural residents will lose their health coverage. 360,000 children, nearly 1 in 4 seniors, to Brian's point, losing their nursing home care. We have an aging population in Georgia. And that number will continue to grow. So in total, that's more than 630,000 people who are going to be impacted. And that's not even including, the impact on the existing system, right? Governor Kemp was one of, I think, maybe 10 states to decide not to pursue a federal support for Medicaid. And so we've got our own kind of program, but the program in Georgia is not working the way that it needs to work. Only 12,000 of nearly 250,000 eligible Georgians are on this program. And so if you think about what is the impact, at ACC, we write a lot about the cost of living and the impact of everyday policies on everyday people. And healthcare continues to be one of the areas where we struggle most in the state of Georgia.
Mm-hmm.
Yes, we are a great state to do business. We are not great at taking care of our people. And at the end of the day, I think we have to ask ourselves, what do we really care about?
What do we value the most? Yeah. With that said, Brian, is there a chance that Republicans will step up and cry foul as to what's happening?
Well, I think you're seeing a lot of Republican members of Congress say we're not going to cut Medicaid. I think I've seen even super conservative, very MAGA members of Congress like Mike Collins say, no, we're not going to do that. Then on the flip side, you've got a congressman like Andrew Clyde, who represents Northeast Georgia, who is certainly more conservative than the mainstream of the party, but is making some points that resonate with a fiscal conservative like me. He's saying, "Hey, we're about to cut these taxes. We have an unsustainable budget. We got to make some hard decisions." So I think you're seeing both sides within the Republican Party playing out. There's not a big appetite to cut Medicaid tremendously, particularly as you begin to see more working class folks become Republicans. It changes the politics for Republicans. I mean, think about it. The Republican base in Georgia, I bet you a lot of them in the state are on Peach Care for Kids, which is part of the federal S-chip program, but is branded Peach Care here in Georgia. A lot of Republican families depend on that. So this is not an issue that it would have been 30 years ago, where Democrats are defending coverage for their base and Republicans, represent these rich people or these professionals who don't have skin in the game. That's not the case anymore. Republicans do have skin in the game. And I do think there's an understanding that a lot of these rural hospitals, many of which are in Republican districts, depend on Medicaid. So Republicans are not blind to it. At the same time, I think Republicans aren't blind to the fact that this isn't sustainable. So how can we smartly address it? It can't be a lopping off of it, as I said, but there's got to be a bending of the cost curve. I don't know how you do it. I'm not smart enough for all that. I think there were easier solutions to be had 20, 30 years ago. We're kind of too far down the tracks now to have easy solutions, but something's got to be done, but without losing all of our hospitals and nursing homes.
Saba, I don't know. What do you think? Can Democrats and Republicans work together, across the aisle and tackle this?
I mean, that's a philosophical question. But
Do
I
you
mean,
see it
one of
happening?
the right.
You can curse here if you want.
Right. As a sidebar, I just had a conversation with my dad about cursing, and he is like, they're very much anti-cursing, and I assured him that I do not curse.
Right?
Right. One quote unquote easy solution would be to roll back the original Trump tax cuts on the most wealthy Americans. That would help alleviate this budget gap that we're talking about. So that's one. I think another would be to look at, other Republican states. If you're Kemp, maybe you don't want to look at what a Democrat is doing, but look at what, say, maybe a state like Montana is doing around this particular challenge. And then there's a lot of talk about work requirements and what is appropriate around work requirements, right? If I am taking care of an elderly or disabled parent or sibling or child, there should be some relief on work requirements, because that in itself is a job. And so there are a lot of things around that, around this work requirements issue that's really tripping up families, and it's costing them time, it's costing them excess paperwork, and it's costing them the health access that they need.
The work requirement is something that's hugely important to the politics of all of this, because Republicans can get behind Medicaid, but they want to know that everybody is pulling their own weight. They want to know that people are trying. They don't want somebody who is just passively getting government benefits. There has been and remains a lot of consternation among Republicans about able-bodied adults getting Medicaid. Governor Nathan Deal, who is a man of great compassion, and his record certainly shows that he cared deeply for the most vulnerable in our society, was adamantly against Medicaid expansion, partly because he thought the federal government would eventually cut back its share from 90-10 to a smaller share, and it would become unsustainable. And he may be proved very visionary in that right now. But he also was strongly against able-bodied adults getting government health care. He was like, that's not what it was intended for. That is not sustainable. They need to be able to go and get it somewhere else. Now, I know for a lot of the lowest income folks, there's not somewhere else to get it. You don't get it if you are working two jobs at a fast food restaurant, or perhaps in a landscaping company, etc. But the fact remains we can't put everybody on government health care, even if they have a compelling story, even if they do desperately need it, because we just simply can't afford it. We're 30 plus $1 trillion in debt. We're in bad shape. There's going to be pain. There is going to be bad things that happen. They can happen now, and we can do it in a step-by-step process, or they can happen later in a catastrophic way. But we have to make that decision.
I agree with the pain. I mean, we just saw that when the United States credit rating just got bumped
Absolutely,
down,
yes.
right?
Yeah.
But I think the challenge here is that across the country and across the state of Georgia, we're living in a zip code lottery, right? Whether it's access to healthcare, whether it's access to good jobs, whether it's access to affordable housing, it is a zip code lottery. If you can't afford a great place to live, if you can't afford great healthcare, you are SOL. And that is a real problem. If you talk about what is the future of the United States, if I feel helpless, if I feel like no matter how hard I work, the cards are stacked against me, that's not good for this country. And that's what we're moving towards.
So everybody has skin in the game. It's just how we're going to manipulate this and navigate it.
Yeah.
And even for a middle class family, if you've got, I mean, I think about for us, right? As my parents age, I worry about, are we prepared financially to take care of them, right? And they're firmly middle class, but it's still okay. If God forbid something happens,
That concern,
can we
what if?
afford?
Right.
Can we afford a live-in nurse? And that's just not my family, Brian. That might be something that your family is thinking about as well. And so multiply that, and we have a question about what do we value as a society, and how are we moving forward and spending money based on those values.
No, I have lived it, and I have thought about this for numerous years for this because of this very reason. We're so often compelled more by narrative than by data, right? By the stories that we see around us in our real lives. And a wonderful woman, a family friend who was a child caregiver to my daughter for the first 4 years of her life, had to leave us to go take care of a mother with dementia who could no longer care for herself, and Medicaid would not cover the cost of putting her in a nursing home. For what I never understood the reasons why they didn't qualify, but they would have had to do the spin down, sell their house, do all of this horrible things that they didn't want to do, and basically her means of making a living were taken away from her because she had to stay home with her mom. And she wanted to do that. She wanted to be with her mom. She wanted to be there through her dying day. And she was. Her mother died late last year, actually. But that's not an option for all families. Some folks who have with young kids, they can't quit their jobs and take care of a parent or grandparent with Alzheimer's or late stage dementia. What do we as a society do in that scenario when it becomes economically infeasible to pay the cost of keeping alive someone who we've lost mentally already? It's something nobody wants to talk about because, again, it's cringy to talk about it. But we're talking about hundreds of millions, billions of dollars across the country a year.
Yeah, so many layers that have to be peeled back. And this is another one. We're just going to have to hold on, for the ride and just kind of see where it goes.
And it's going to be tough. Look, I'm glad that the Republicans are having this discussion. And Democrats are super excited to hear Republicans talk about being responsible because they want to use it against them. They want to use it as a club against Republicans. I don't think Republicans are going to do something reckless here that's going to cause catastrophe because that's bad politics as much as anything. And because these members of Congress care about nursing homes and hospitals and seniors and the low-income workforce in their districts. They do. No matter how they're painted, that they do care. The issue isn't about being mean to low-income people or to seniors.
Wow.
It's about how do we make this sustainable. And the Democrats are going to use it as a club. It's going to make it very difficult for Republicans to have a meaningful conversation about it. There are elements of the Republican Party that do want to see significant reform and some elements that don't, to be honest. I don't know how we can come to consensus without it being used as a political nuclear bomb.
Saba, any final thoughts?
Yeah, I think we will continue to, to stay on the medical term here, sort of nip and tuck at this issue, rather than make, transformational changes, and sort of kick the can down the road until the problem becomes too big to ignore. And again, this is a question about what we prioritize. There are ways to do this that, do the least amount of harm possible. But I don't know if the political will is there to do that. Yes, this is a partisan question, right? Or and what policies might make sense. But at the end of the day, if your loved one is sick, you don't care if the person caring for them is Republican or Democrat or independent. You just want your family member, to have good quality health care. And you don't want to go bankrupt because of it. And I think that's what we need to keep in mind. These policies impact real people, real families.
That's the bottom line. I feel like we've ended on a down note this week on our show.
Maybe it's
Brian,
the state of the world. I went to Our Lady of Lourdes Sunday, and I'm not Catholic, but I went with a friend, and it was, the first mass at the church.
Since the new pope.
At least since the Pope's first mass. And there was an archbishop there who is a Ukrainian American. And he was visiting the church, and he talked about, he shook the new Pope's hand, Pope Leo, and he had, went to the funeral for Pope Francis. And the liturgy was about love. And, it's kind of funny how, the universe, God, whatever you believe in, brings things to you as you need them. And I feel like the world has been very heavy. And people are always asking me, "Oh, Saba, how are you doing?" And I'm like, I'm moving. Like, it's, everything's okay. Because I try not to dwell too much on what's happening. But hearing this sermon about love and loving your neighbor was really, it fed my spirit in a way that I really needed. And so there's some positivity for you.
Yeah,
Brian,
I love it. Yeah.
You're my favorite Republican, and I love you. Okay.
A group hug virtually, right? All right. Great checking in with both of you. And Saba, as always, thank you for filling in and being at the ready.
My pleasure.
All right. Y'all have a great week.
Thanks, guys.
Take care.